Do not leave this podcast without going to the link in the show notes or description and clicking on the link to learn our centralization process. We will show you what you're missing in your sciatica recovery. And in this link, there will be a very important opportunity at the end for you to learn exactly what this plan could look like for you. Hello and welcome to episode 95 of the Low Back Pain Podcast. I'm your host, Dr. Grant Elliott with RehabFix online low back program. Today's topic is MRIs increasing risk for surgeries, making your low back condition worse. Is this possible? We're going to talk about it today. If you have not joined my private Facebook group, RehabFix Low Back Program, you must do this because there's thousands of dollars worth of information in there that could be essential to your recovery. And these are posts that I cannot make on Instagram or on TikTok or anywhere else. There's exclusive content in here. There are free sciatica guides, which you will be tagged in immediately upon joining. You will receive our step-by-step guide to learn our centralization process cure towards sciatica and disc herniations so you can take this guide yourself, learn more about your condition, and additional resources and connections with myself and my team so you can truly immerse yourself in a community of individuals who are willing to take action on their low back pain. And this is a free group. So go join RehabFix Low Back Program. Now, today's topic, MRIs. I make posts about MRIs all of the time, and there is still so much misinformation about MRIs. Even today, I met a lovely woman from Russia at the local little kids playground. We started talking, just friendly chit chat, brought up her back, how she has a disc herniation. Of course, I brought up our program and what we do, and we started talking about it a bit. And immediately she brought up imaging. And how, I had an MRI, I have an L4-L5 herniation. I showed her some of our testimonials and she asked, is it possible for disc herniations to fully recover? Do you do pre and post MRIs of your clients? And immediately I had to, take a couple steps back and educate and say, hey, you know what? Imaging doesn't tell you if someone's recovered or not. It can't tell you if someone's recovered or not. Someone could get a 100% improvement and the disc herniation could be the exact same. So we don't want to use imaging for clinical judgment. And in fact, now we have studies supporting that if we try to use MRIs in place of clinical reporting, symptoms, conditions, prognoses get worse. They get worse. This is true. And here's a study I'm going to reference from 2021 right now. The name of the study is The Catastrophization Effects of an MRI Report on the Patient and Surgeon and the Benefits of Clinical Reporting. These are results from a randomized controlled trial and blinded trials. So listen to this, okay? 44 different low back pain patients were randomized into two different groups. Group A, who had a factual explanation of their MRI report, basically meaning, hey, what their MRI report says, read through it, factual, that's it. No context, no additional education. Or group B, who were reassured that MRI findings were correlated to normal changes based on the evidence about asymptomatic findings and MRI results being false positive and false negative. So education and reassurance about normal age-related changes. The outcomes were compared at 6 weeks through multiple different testing sequences. And what this was done for was to determine how different groups of people with low back pain respond to different information about their MRI. So what is the conclusion of this study? Here is the conclusion of these 44 individuals in different groups. The results are, after 6 weeks of treatment, Group A, so the people who were just told, here's your MRI report, which is pretty much what 99% of people alive are provided. Group A had a more negative perception of their spinal condition, increased catastrophization, which basically means, everything's a catastrophe, worried, right? Everything's bad. Decreased pain improvement in poor functional status. Poor functional status, decreased pain improvement, meaning they didn't really improve much, more catastrophization, worse perception of spinal condition from being read your MRI results. Yep, as opposed to the group B of clinical reporting, so not image reporting, clinical reporting, they found significant benefits of lesser severity of the disease, a shift to lesser severity of the intervention, and lesser severity or likelihood of surgery in the groups as well. And this included the influence on healthcare providers. If healthcare providers were provided just the written report, the likelihood for them to perceive the disease as worse or lead to surgery was greater than those who were provided in education in a clinical reporting of the individual, in a clinical reporting of the MRI. This is huge. This tells us in this conclusion that routine MRIs reports produce a negative perception and poor functional outcomes in low back pain, and that clinical reporting had significant benefits, and that we need to be providing clinical reporting rather than imaging reporting. However, image reporting is what everybody has provided. Everybody's provided this. Additionally, there are more recent studies that show the more MRIs that are in a given city, the more back surgeries occur within that city. More MRIs, more surgery. There is a direct correlation between this. Okay? So MRIs will lead to more surgeries, will lead to worse outcomes, will lead to poor functional outcomes. They will lead to poor perception and worse severity of the disease and more chronic severity of the disease. This is fact. This isn't my opinion. This is the current evidence-based influence that is present. We know this for fact. I talk about this all the time, but I need to continue hammering it. MRIs are a tool, and what they're used for low back conditions are basically just to make sure that you don't have an infection and that you don't have a tumor in your spine. That's about it. Okay? That's about it. If there's no infection in your spine, if there's no tumor in your spine, the rest of it, most of the time, is irrelevant. Most of the time, you don't even need to hear the MRI report. As long as the MRI report should literally just say, no tumor, no infection found. That's literally what it should say. If that's what they all said, instead of finding anything to talk about, oh, there's a disc bulge. Wow, most people have disc bulges. Oh, there's encroachment on a nerve. Well, no duh, the person has sciatica. If it excluded all of that crap, and if you weren't just told, oh, here are your MRI reports, you have a disc bulge. Oh yeah, it sounds really big. It's this many millimeters. It's pushing on a nerve. Ooh, this doesn't look good. If you're told all that crap, it's going to make your situation so much worse. So much worse. And as I say all the time, the more bad advice you're provided, the more valuable good advice becomes. And you want to make sure that you work with someone who understands the clinical reporting for MRIs, that understands that most of the time MRIs are not necessary unless there are red flags. I've created a podcast on this. Go through the rest of my podcasts and look for the one that talks about when to see a neurosurgeon, because I talk about these red flags. But if these aren't present, you don't need imaging. Imaging makes things worse most of the time. They are just a tool. They do not tell you what the problem is. A lot of people also will tell us, hey, you know what? Well, I just want to go get an MRI anyway because I just want to know what's going on in there. I just got to know what's going on in there. It won't tell you that. It will not tell you what's going on in there. MRIs don't tell you that. MRIs provide so many false positives, so many false negatives. They're not going to tell you what the answer is. They're not going to tell you what's going on in there. Your general doc that reads that MRI report that freaks you out, they're not going to be telling you what's going on there either. A proper clinical assessment will, though. A movement-based assessment will tell us what your current functional status is, what the problem is based on your movements, what exercise and movement-based influences you can implement into your life to recover from that situation, and will tell us more about your prognosis than anything else. An MRI, once again, as long as there's not a tumor or an infection present on the MRI, is pretty much irrelevant for disc and sciatica issues, and it will most likely just make your situation worse, leading to a higher chance of surgery, a higher chance of chronic pain, a higher chance of worse functional outcomes. MRIs are not the answer. They will never be the answer, and you do not want to make judgment calls based on them. Do not get an MRI just to know what's going on in there. Oh, my neuro or my ortho or my GP said we should get an MRI just to really know what's going on. No. This is the old biomedical model that's taken over, Western healthcare, that dominates, that leads to poor outcomes. And that's just the way that it is. So that is why we take all of our clients through an appropriate clinical assessment. We assess your movements. We assess your situation. We actually listen to you. We spend time with you. We don't just spend one minute with you and say, oh, you have back pain, go get an MRI, read you the report and say, oh, based on this, you need the big three: painkillers, muscle relaxers, anti-inflammatories. If that doesn't work, let's get an injection. If that doesn't work, let's go to surgery. That's literally what 90% of our clients are told. So we're here to get away from that. We're here to actually provide you a plan, an actual plan to follow, focus on these types of conditions and specified towards your unique situation so that you can learn how to fix yourself, how to get out of the situation, how to truly recover for life and carry these tools with you. And if you would like to learn what this plan could look like for you and you want to learn how this is possible and how you can finally get pain-free, then submit an application on our website or simply follow the link in the show notes of this post. Click on the link to look at your own demo of our centralization process, how we have taken thousands across the world through accurate step-by-step back pain and sciatica reduction. You will learn our process, you will see how it works, and you can have an opportunity to learn for yourself. Be sure to join our private Facebook group, RehabFix Low Back Program, for more additional resources. If you are listening on your favorite podcast platform, please leave a 5-star rating and review so we can grow this podcast and reach more people. As always, move more, move in nature, move in the sun. Thank you so much for listening and have a great day.